I'm going to show you the fastest path to patient case acceptance and how to minimize fee resistance. Are you getting enough new patients in your practice each month? Could you use more? Of the new patients, how many are maintenance only? How many have opportunity for more extensive dentistry? And how many say yes to the dental plan that you prescribe initially and accept it at the fees that you set? Hi, my name is Ron Sheets, and I'm not a dentist, but I am a patient. I've been a patient since I was a kid, and I've worked with a countless number of dentists and interviewed hundreds of dental patients for my private clients all over the country. My specialty is video marketing, more specifically, patient video testimonials. I've developed a system for capturing patient testimonials on video and turning them into powerful marketing tools for the practice. In this video, I'll show you specifically where you can apply video testimonials in your marketing to find the fastest path to getting patients to accept the cases that you prescribe at the fees you present, allowing you to do the kind of dentistry that you want. I'll start with a very generalized new patient funnel through a practice. Now, this may or may not resemble yours, but it's kind of what I've observed in working at the many practices that I've been in. First, let's talk about how the patient is introduced to the practice through the marketing, the advertising, or the referral. Now, they call the practice to schedule an appointment. This is what we call a new lead or a patient lead. Next, during the initial consultation, you may perform a brief diagnostic exam to establish what their needs are. From that diagnostic consult, you'll develop a dental plan and then make a case presentation. At this point, one of three things will happen. They will say yes, and the case will proceed, or they'll say no, and nothing will happen, or they may say maybe. Now, maybe can take on several different forms. They could say that they agree with the plan, but they're uncomfortable with the fees, which is to say that it's too expensive. So what percentage of case presentations of yours result in yeses, nos, or require you to sharpen your price pencil, so to speak? From maybe, it can continue on and on and on. You could get a yes out of a redesign on your case presentation, redesigning that dental plan. I've actually witnessed a patient who was presented with 5 variations of a plan until he finally said yes. And after he said yes, and that 5th variation, the fee was significantly less, and the plan was significantly less than what the original doctor had originally had diagnosed for this particular patient. So let's look at how you can use video testimonials within this model to increase your conversions to yes, reduce the no's, and minimize price resistance, or at least the maybes. First, how do patients find you? Through traditional advertising and marketing that I've seen, there's often free offers or free consults, free exams, x-rays, teeth whitening offers, Invisalign, teeth in a day, 6-month smiles, many different ways in which to motivate the patient to call the practice. But there is a reality that I have learned, and I think that my client, Dr. Bob Matasevich in Santa Cruz, California, put it perfectly. He said that his biggest marketing challenge was not in getting the patient in for an appointment. It was simply just getting them to pick up the telephone and call to make an appointment. So why don't people call the practice? Well, first, it could be a bad experience that they've had with a dentist. I have hundreds of patients that tell me this all the time. In fact, recently, a patient shared that as a child, she got so nervous and so anxious in going to the dentist. On one of her visits, she started to cry, and she admitted she was bursting out and so forth. The dentist had gotten so frustrated with her that he slapped her across the face. And ever since then, she told me that she's been afraid to go to the dentist. Fortunately, this kind of experience does happen. You know it. You probably have patients that have told you similar things about their past experiences. Second, it could be the pain or the perception of pain that they associate with going to the dentist. It could be that past treatment just didn't take or it needed to be redone. My wife has had this experience personally. At a previous dentist, she had to have a crown redone 3 times. Now, needless to say, it was grounds for us finding a new family dentist. Fourth, They just may not understand the treatment plan that's being presented to them. They just don't understand the value of why they need to move forward with it. Or last, and this is a real key one, is trust. The trust just hasn't been established with the patient, between the patient and the dentist, and even more importantly, the dentist, the patient and the practice. Again, I recently had a patient tell me that she left her dentist because she just didn't like the staff. She didn't like the team that was there. She loved the dentist, just didn't like the team. And it was grounds for her to leave the practice. So with regard to this trust, this overall arching trust idea, there are 9 things that patients are just trying to figure out about you. These are the 9 things. First, they're trying to find out, are you authentic? Are you real? Or is the marketing just hype? Is there a real person behind this marketing? Is there a believability? Are you telling them the truth? Do they feel comfortable and understand what you're telling them? Is there credibility? Are you really knowledgeable and competent about what you do? It's a feasibility of the relationship. Now, this isn't about money. This has to do with, are you appropriate for them? Can they see themselves being comfortable with you? Because face it, they have to sit in the chair and you have to work on their mouth. So are they comfortable with the relationship that they would have with you? 5th is customized solutions. They want to know, they have to believe that you're listening to them. They don't want to know that they're just another number on a patient chart to them, much like the big corporate franchise dental clinics that are out there. And patients tell me that they don't like these type of operations because they feel like a dental mill. One patient told me that he called it a dental carousel, where it was basically you went to the practice and wherever the dental carousel stopped, you got on, and that was the dentist you saw. And they don't like this. 6th, it's the safety of the security. Are you reliable, and can you be relied upon? They want to know, are you going to be there for them when they need you? There's a lot of security that goes in picking and choosing their doctor. And I know that you know this. I'm not saying anything you don't know. 7th is the comfort. Do they understand enough about what you can do for them? Superiority. Are they making the best choice versus other choices available? Meaning, are they picking the right doctor for them as compared to other doctors that are out there? And lastly, value. Are they paying a fair fee? Now, this doesn't mean are they paying the cheapest price. Are they paying a fair fee for the value that they're getting? And that's that's a key part. So with that said, let me delve into applying patient video testimonials into your advertising and your marketing. And I'll start with the new patient lead generation on how you get a prospective patient to call the practice. Now, the objective is to get them into the practice, but the obstacles are high, as I've kind of laid out already. Yet most promotions, the free whitenings, the 6-month smiles, these things are all based on an offer, and they don't often talk about the doctor or the practice, which is so key. It's instrumental for a patient in choosing which doc they're going to go to. Now, I've interviewed hundreds of patients, and every one of them has told me that they chose their dentist because they liked and trusted him or her. Now, the dentistry is important, but the person performing it is most important. You are not paid for what you know. You're paid for who you are and what you can do for the patient. My client and mentor, marketing guru Dan Kennedy, says that it is far more important that the patient know. They don't have to understand they don't have to understand you. It's important they understand that you understand them and what their needs are. Again, this goes back to that customization. Are they not just a number? And that you're tailoring a specific plan for them and not just selling dentistry because you got to keep the lights on in the practice. This is very, very important to the patients. So again, you're not paid for what you know, but for who you are and what you can do for the patient. Now, a DVD of patient testimonials can be used as a lead magnet, or what I call a lead magnet, to give prospective patients the chance to experience what it's like to be a patient of the practice without actually having to make the commitment to it. They can hear from other patients on what their experiences are like as you as their doc and attending and coming to your practice. You can use this in itself as a lead magnet, as opposed to, or not in replacing the offers on Invisalign specials or free consults, not replacing it, but offering it even as an addition to it, giving them the opportunity to understand what it's like to be a patient before they ever have to come into the practice and be a patient. I look at it this way, and I've kind of identified after interviewing a bunch of patients, is that patients with bad experiences or have fears of pain or those bad experiences that they've had, I picture it like this. When they show up at your practice for the first time and they're standing outside the door, they're looking at the door and they're asking themselves, what's going to happen to me inside that practice that's different from what I've already experienced at other practices? This is going through their mind, and it's very important to understand this. And I think this is why it's extremely important to start the relationships, to start that patient-doctor experience long before they even get to the practice. So using patient testimonials as a lead magnet, it allows you to start that sales conversation, if you will. You can start differentiating yourself from other practices that are out there. Most practices, as I said, rely on that patient experience to start when the patient arrives at the office. The experience should start long before that. So then let's consider a prospect who comes to you through existing or traditional advertising, not using this type of lead magnet. You could send them virtually the same DVD of patients talking about you, those advocate patients talking about their experiences with you before this new patient comes to the appointment. This will give that patient a predisposed knowledge and liking of you. They'll start to like you and trust you before they even come to the office. So the experience starts before they even show up. As I said, too often selling starts too late in the relationship building process. Now, I know that selling is a nasty word, but that's what happens when the patient says yes to a case presentation. And it's a better relationship for you and for the patient if they're eased into that buying decision rather than having it forced on them to make a yes or no decision abruptly when the case is presented to them. For getting new patients to the yes the fastest, I think these two areas are the most important things that you can do in marketing, using patient video testimonials to start the relationship and rapport building process. And it's the fastest path to getting the patient predisposed to want to work with you, or at the very least, to compare every other dentist against you and your practice. Next, it's the new patients that proceed with a case plan. Now, they're likely going to be an advocate for you, and they're going to be able to refer other people to you. I hear from patients on how they refer friends, family, and coworkers to dentists all the time, but they also tell me that they don't know if the person they referred actually followed through and called the practice or even became a patient. Do you have a system for patients to refer others to you? You could. Patients can be armed with a stack of DVDs of patient testimonials that they can hand out when they're referring you. Now, I've developed a system for using these DVDs, and your patients don't even have to do any of the selling. All they need to do is refer you, and then the system takes care of the rest. Next, what about those cases that go undone? Do you have a system for following up on them? It's likely that they're going to continue to go undone. There's money in the follow-up on this stuff. You can use patient testimonials in a follow-up video email sequence to keep in touch with those undone cases. You can always be on top of mind when they're thinking about that or considering to move forward. It's about being in the right place at the right time when they finally decide to accept the case that you presented. And with today's technology, this can be done automatically and for very little investment. You've already invested in getting that patient to the practice. There's no reason that you shouldn't keep nurturing that patient until they finally say yes. Now, there you have 4 powerful ways of infusing patient video testimonials into your advertising and your marketing. You can get started right away if you already have patient video testimonials. If you don't, then you can go to and get a free guide that I have available at www.patientvideotestimonials.com. I actually go through this guide and I give you the 7 keys to what an effective video patient testimonial is and how to ask for them and actually get them captured and then what to do with them. So if you haven't already started getting patient testimonials, go to patientvideotestimonials.com. It's a free ebook download, all you need to do is provide your name and your email address. So you have 4 ways to add differentiation to your advertising and your marketing, and that's just 4 of them. But I've actually identified that there are 33 different ways to apply a single video testimonial in your marketing. If you'd like to get a copy of my 33 ways, email me at info@rjmediamagic and I'll mail you a copy. In your email to me, include your name, your address, no P.O. boxes, city, state, zip, and your phone number. And I'll mail this out to you at my expense. Now, I don't send this electronically because the information is so valuable, I don't want it stolen online. And lastly, if you have questions on how to get started or get this stuff implemented into your practice effectively, you can simply go to www.askronsheets.com and submit your questions to me. They come directly to me, and I answer each question personally. So your next step is A, to get my guide to learn how to get and capture powerful video testimonials from your patients. Or you can get the 33 ways to leverage a single video testimonial in marketing and advertising. Or you can get answers to your implementation questions on how to get started. So I look forward to hearing from you in one of these 3 ways, or all 3 if you'd like.